my name is Michelle and I'm a student nurse at VSU and I'm going to be inserting your IV catheter today. Have you ever had an IV before? Okay, it's just a small tube that's inserted through a vein using a needle, and it just allows us to provide you with fluids and medication. I'm going to perform hand hygiene and provide you with some privacy. And can you verify your name and date of birth? Okay, and that matches with the doctor's order. So I'm going to... Are you allergic to any medications or latex? No? Okay. And we'll just use this vein right here. And I'm going to prep my equipment. I have a pre-filled sterile syringe of sterile saline. I'm going to prep the line, filling it with saline to remove any air bubbles. First. I'm going to insert the needle at a 10 to 30 degree angle with the bevel up. And I'm observing for flashback and continuing to insert the catheter while removing the needle. This would go in my sharps container. I'm going to flush the line to ensure that there's no buildup or clots. And I would put my initials, date, and gauge on here and the time of insertion. the tubing, I've pre-prepped my tubing. I've ensured that I have the correct patient, correct medication, correct dosage, correct route, and correct time. And to prep the tubing, I would spike the bag, fill the drip tube squeeze it and fill it halfway, and I would remove this cap and allow it to flow slow and steady into a trash can to fill the tube with fluid. And then I would close it back up. I don't need that one actually. I would uncap it or release the flow. Ensure that all the plugs are open. Clamp it, and I would start my flow and ensure that the tubing is stabilized. And that would be inserting the catheter. To remove the catheter, I would stop the flow, I would close the clamps, and I would just remove everything as before. I would clamp this tube to ensure that it the flow would not come back. I would remove it, reinstall the cap. And I would remove. I would apply pressure and apply a Band-Aid. And that would be inserting and discontinuing an IV.